Joining us now is board-certified physician Dr. Leigh Vinocur. It is great to have you, doctor. Thank you for joining us.
Thank you for having me, Kaylee.
So the secretary's visit, he's about to head out on this 3-day tour with stops in Texas after another reported child's death due to measles. What do you see as the impact of his visit to the funeral and this tour as a whole?
Well, he's obviously, it's probably very hard to console parents for situations like this, communicable diseases. I've always said we have a very short memory when tens of thousands of kids died of all kinds of diseases that we have vaccines for. And we know the stance is this idea of natural immunity, but it sometimes doesn't work. And measles is the most contagious and potentially one of the more fatal contagious diseases because it can cause serious encephalitis. So this community might have been a community that didn't believe in vaccines, but it's hard to say what the reaction of people in the community are going to be to his visit. But his tour was also to talk about a lot of his other proposals to make America healthy again. So it wasn't just related to the vaccine and the measles, as you know. So
yeah, well, how are you anticipating, doctor, these cuts will impact the work that HHS is doing right now?
Well, it's difficult. You know, a lot of the work, some of the cuts pertain to the CDC, some are to NIH. A lot of these things will cause a problem, perhaps, with public health in a mandate that was sort of given by Congress and the American people for certain public health measures. And these cuts will cut deeply into it. So, for example, also part of it, the FDA cuts will have issues with food safety, or will there be lags in getting drugs and approval of medications? I understand chronic disease is a big issue in this country, and it's important to address that too. But you need research to do that, research to develop new medications for chronic disease, along with lifestyle changes, which I'm a firm believer in. So some of the things talking about lifestyle changes are key, but you have to be realistic about it too. You know, not everyone in America has access to healthy fruits and vegetables. They live in food deserts. So there's issues trying to really push forward lifestyle changes to manage chronic disease too.
Well, I want to talk more about RFK Jr. ensuring that programs like Medicare and Medicaid won't be impacted in all of this. That certainly got a lot of people's attention. How might the effects of these cuts, from your perspective, be felt by everyday Americans, doctor?
Well, I think that, you know, you have to have enough people working in these agencies to carry out the tasks that are necessary in the agencies. In Medicare, in Medicaid, these programs are critical, you know, for the health of Americans. And if you don't have enough people working in some of these programs to ensure that they're getting the coverage that they need, any changes in coverage, any approvals of coverage. I mean, if you don't have people, and when you're talking about illness, right, delaying time to allow approval of a procedure or something like that, it can cost lives. We've seen that in the private industry, and trying to privatize it, getting rid of more federal workers and trying to privatize healthcare more, that's going to be a very big issue, because we know there are issues with getting critical care, cancer care, critical diagnostic tests in the private sector of insurance. So.
All right, Dr. Leigh Vinocur, great to see you. Thank you for weighing in.
Thank you for having me.